Hey, it's so nice to have everyone joining us. I'm sure more will be coming in as we get going. We're honored to spend this time together in the Advocacy Exchange for today's focus, the courage of action, empowering lessons from the Alzheimer's community. We're honored to have two advocacy leaders who also share very personal experiences in Alzheimer's. And in particular for this conversation, we always try to plan these sessions to make sure that we create space for certain topics that really need to be addressed and need to be addressed openly enough. And so this topic today will really focus on the caregiver experience and then how individuals who have those experience bring that and leverage that experience in the work that they do to create better outcomes for families facing Alzheimer's. And so we welcome you to join that conversation. We'd love for you to connect anytime in the chat. Feel free to jump in, let us know where you're coming from, share any comments or questions as we go. Okay, to get us started today, we have a quick question because we want to know what your relationship with Alzheimer is. And so our team is going to prompt a poll here. Please take just a moment as we get started to tell us what your relationship to Alzheimer's is from the options below. So we see that there are some caregivers, some advocates, some individuals who work for organizations that advocate for people with Alzheimer's, and then a really good group of people that are here to learn from the Alzheimer's work that you're all doing. And so we wanted to ask that because these relationships are really such an essential part of advocacy and creating better outcomes. And I want to take a moment before we start with our panelists to thank BMS and the Global Patient Voice team for how much they build relationships and really seek to bring the lived experiences of patients, caregivers, and advocates into the work they do. For me personally, I'm the CEO of Grit Health, but I'm also a patient and caregiver. And I try to be present to each of those roles in my life in all of the work that I get to do. And so, with that framing, I have the honor of introducing our two guests to share their stories and their experiences with us today. If you'll first please help me welcome Pamela Price. Pamela is the Deputy Director of Balm and Gilead. And Pam, we're honored to have you share your story with us.
Thank you so much, David, for having me. I'm really honored to be here. Um, Much like you, wearing multiple hats, I think it was nice to really see the poll and the mixture of kind of why individuals are here. I like to lead with that why in terms of why do we do the work that we do. And as Deputy Director of the Balm and Gilead, overseeing the multitude of programs that we have, what always comes back and centers that is really finding ways about how do we help our families, how do we help individuals, how do we help our communities really be the best versions of themselves that the moments we find ourselves in now are calling us to be. And so whether that's through our work with our Brain Health Center that specifically focuses on Alzheimer's and dementia, or whether that's diabetes, mental health, maternal health, we really try and make sure that that is always front and center of the work that we do. That matters to me both professionally, as someone who has been in this space for 20 plus years now. Sometimes it's astonishing. I think about how long I've been doing this type of work. And I hope to be doing it for another 20, 30, more years because I truly, really enjoy this work that allows me to meet at places where I'm both passionate about and where I have been touched on a personal level. And I know we'll have some opportunities later to kind of share about how this work, how this journey that we are on as caregivers or those of us who are in this Alzheimer's space and what that looks for us and how do we bring those parts of ourselves and parts of our personal stories into this work as we're advocating for others.
And you have such powerful, profound experiences in your personal life that you bring into the work you do for your organization, but to change systems. And we're excited to have that conversation. And Russ shares that as well. And so it'll be a really powerful conversation together. Please also, everyone, help me welcome Russ Paulsen, who's the Chief Operating Officer for Us Against Alzheimer's. Russ, we're honored to have you with us today.
Thank you. And it's great to be here, and great to be here with such powerful folks as Pamela, who I want to emulate in my commitment to this field. I know that she's got such a long commitment. I've been in nonprofits my entire life, but I joined the Alzheimer's movement about 5 years ago. And I do have a personal connection, but I also personally joined because my life has been spent trying to take on really big problems. And this is a really big problem. And we're at a good time now to make a difference in this disease, and it is a disease. But I'm just really glad to be here at this moment when there's so much positive to talk about in this field. Us Against Alzheimer's is about an 11-year-old, 12-year-old nonprofit patient advocacy organization. We work on Alzheimer's prevention and brain health preservation, early detection. This is a disease that is detected late or not at all in some people, later in African Americans and Latinos than it is in white folks. And then access to treatments, because we know that access to treatments is going to be a big issue. And in minoritized communities, access to treatments, even in well-established things like drugs for cholesterol, minoritized communities have less access to that than white folks do. And we've, since the founding of this organization, really taken an interest in making sure that everyone has access to the most important stuff. So glad to be here. Happy to be part of the conversation. Thanks, Dave.
Thank you, Russ. I know something that we talked about in our prep for this conversation is, how much everybody's experience is unique. And we always want to respect the individuality of how everybody goes through their journey, both the person living with the diagnosis as well as their care partners. And we thought that was such a powerful way to start. So, Pam, if we can, please, in whatever context you're comfortable, share with us what that's been like for you.
Wow. It has been, if I think of ways to describe it, it has been empowering and inspiring in moments. And then it has also been daunting, overwhelming, and challenging in moments. And I think that's why we like to frame it and frame the conversation as a journey, right? So for me, having a background in nursing and in healthcare, you kind of know how the body works. You kind of learn and get an understanding of anatomy and brain health, right? And what that means. But it wasn't until Alzheimer's kind of knocked at my family's door that I really was like, okay, I need to know more about this, because my family is looking to me as the educated one to say, what is this and what should we do? And this is what the doctor said, and is that true? And just kind of remembering what that was like as an extended caregiver for my grandfather, who was diagnosed. And even though I was not there in some of the day to day, but just thinking about conversations I had with my grandmother, conversations I had with my aunties and my uncles about how were we going to navigate this journey. And for us, it was trying to navigate a disease that we knew nothing about. We think like, oh, wow, there are so many signs that we missed that maybe we could have called it a lot sooner than what we did. And it was those things that then about, I don't know, 5, if not more years later, I find myself here with the Balm in Gilead, and we are wanting to basically, kind of to Russ's point, we wanted to create something, build something that addressed kind of what my family had experienced. And as we started talking with others in the community, talking with people in our churches, and just really anywhere where we thought someone would want to hear what was going on, right? And then we say, oh, wow, there's a lot of gaps, there's a lot of misinformation. And then our communities just don't know. We are all just under the impression that just live long enough and Alzheimer's is coming, and we can't, there's nothing we can do about it, and you're just going to have a senile grandparent at some point. And we do the best that we can for them, to keep them at home. So there were never even conversations about what else do we do outside of at home. What do we do about treatments and medications? And how do we navigate all the other health problems that my grandfather had at the time? And that's really kind of how we built our brain health center. We built it with people like myself and my grandfather and my grandmother in mind, and thought about all the things that if I had it in my power, I would have made sure that our family had. And then even now, as where I'm at present day, my husband's aunt, we lost her at the end of last year. I watched her husband, who is well into his 80s. I watched Uncle James care for Aunt Tootie for the duration of her illness. And it was really bad towards the end. And he was adamant that she was going to stay home, that he was going to be the one to bathe her, to care for her, to do all these things. And mind you, he has worked in the landfill area in construction and concrete. So this is an 80-something plus year old, man who worked every day, 8-10 hours a day. And then he came home and he cared for, my aunt. And it's those individuals, it's their stories, it's their journeys that I make sure that I always keep at the front of my mind when I'm in spaces like this, or when I'm in DC and we're thinking about access, when we're thinking about utilization, when we're thinking about education and awareness, and how do you even broach these conversations in our community, in our families. And that is what I am always excited for.
Find that your brain switches back and forth between caregiver and advocate, and how do you balance all those?
I think because they're so closely connected, right? So my husband did 20 plus years in the military, and he's got some mild cognitive impairment that we're navigating. So even as his wife, I'm always on alert as his caregiver to see, if we are noticing changes. And I think because just innately in terms of who I am always wanting to figure out, how do I connect with individuals? How do I show up and support other individuals to say, what can I bring from my lived experience? What can I bring from my education, from my background, that I can share it with you and hopefully leave you in a better place than what you were before us being able to come together? And so I think it's never really taking one of those hats off. It's really, if I think about it, I'm just constantly wearing probably a very big hat that allows me to tuck a lot underneath that hat is probably the best way that I would describe it.
Yeah. I love that, and I felt that from both of you. Russ, we really talked about, the personal experiences in your life and how they shape the work that you do. So, to the extent that you're comfortable with those experiences, please share.
Yeah, and I always get a little bit sort of weird when people ask me this question, because my experience of Alzheimer's isn't more important than someone else's. And it isn't, and there is no like typical experience of Alzheimer's. So my grandmother at the very end had some form of dementia. This was before there was a real clear diagnostic pathway for that. There still isn't a clear diagnostic pathway, but she had some form of dementia clearly at the end. And then my wife's grandmother had Alzheimer's for real for quite a while before she passed. And now my wife's mother has Alzheimer's disease and other things. And it's been a real struggle. I live in the Washington, D.C. area, but spend about a week a month in L.A. with my wife caring for her mother. And it is quite the experience. But I always want to be careful because this is my experience. This is our experience as a family, watching Alzheimer's in my grandmother and my wife's grandmother and her mother is what it is for us. But I've been around this long enough to know that some of the symptoms that we see are not the same symptoms other people see. And some of the symptoms that we don't see are really, really common in other folks. And so one of the really important things I think for everybody to know about Alzheimer's is it's not a simple disease. It's not just a disease of forgetting. It's not just it's it's a disease with a lot of domains that go into it. And when we talk to people, and we're an advocacy organization, we try to talk to a lot of people so that when we're advocating, we can say we're advocating for the whole community of people with Alzheimer's. The things that they worry about and the things that they're experiencing, we once tried to get a list of them, and we got it down to 42 items. It's way more than, and it's way more than just forgetting. It's not about forgetting it. It is about forgetting, but that's just a small piece of it. And what other symptoms people have are going to vary from person to person.
Russ, I can feel when I speak to both of you, how much you try to respect the individual experiences and the way people want to or have to navigate them. And so, can you share with us, I feel that compassion and empathy so much when you speak. How do you try to tackle all of this when there are that many factors that individuals are concerned about and uniquely concerned about each one?
Yeah, I think that it's going to be key for anybody in this field to recognize that anecdote is anecdote and data is data. And so we try to gather data. We try to find out, is this thing that we're hearing about from one person or that we're experiencing in our own lives something that's pretty common? Is this something that is just really uncommon? When we go advocate on Capitol Hill for people living with Alzheimer's disease, we often come armed with a poll that says, this is what most people with Alzheimer's think. And it's just like anything else in America. Getting more than about 80% of people to say, yes, I think this is the most important thing is really, really hard. But when you've got 80% of the people living with the disease who say, this is really important to me, then you've got something. And then you take your lived experience or someone else's who know's lived experience, one of the people we interviewed, and illustrate that. So you've got to, I think, to do this right, to really advocate right, you've got to combine the heartfelt experiences that you've had or that other people you care about have had or people you've interviewed have had with some level of data behind it to really make sure that you're not representing a one-off, and that you are making the best of your time. Because the other thing, representing the one-off is important, because that is that person's experience. That's that family's experience. And it's never just one person in Alzheimer's, almost never. It's almost always a family thing. Their experience is important too. And you want to be validating of that. And you want to hear that and you want to report that. There's only so many hours in the day. So you want to make sure that you're thinking about how many hours to spend on something if it's really unique to one person, as opposed to the majority of the people. So it's really tricky. I mean, I think that I would bet Pamela and I both spend well more than 8 hours a day working, because the need is just really, really big. And because this disease has been sort of ignored for so long, I mean, Pamela mentioned they sort of just people get senile, right? I mean, there's even I know many doctors today who were trained before the Alzheimer's term even existed as this is senile dementia. This is just which implies that it's just sort of a normal part of aging. So there's a lot of work to do, because we're just now starting to really break through with some things that can be done. But we have a lot of legacy of this is a normal part of aging. This is something we don't talk about. It's a little embarrassing, whatever. We have a lot of legacy that we're dragging behind us, and there's plenty of work to do to advocate.
Yeah. Russ, you mentioned, in the data, there's objective and subjective data, and we need the objective data to develop treatments and to really work on effective broad strategies. But Pamela, how do you keep the humanity, right? The way people experience their diagnosis is how they journey through it. How do you keep that at the forefront?
I think it's kind of a little bit of what Russ hit on, right? So it's saying, how do we illustrate this? How do we bring those stories to life, so to speak? And I really just loved so much when Russ said that it is so far greater than just the forgetting. like what individuals, the more challenging things isn't the forgetting. Some of it may be the behavioral changes that you see in your loved ones. I know, like, that was for our grandfather. Like, how does this sweet man, one minute he turns into an extremely violent who, is he a harm to himself? Is he going to harm my grandmother in this moment? um and again, it's how do we show all the shades? And I think showing both the highlights and the lowlights of the disease, because you do have stories where, again, they are so inspirational and they are so encouraging. And it's how do we weave those stories into the data when community, for us, when I'm saying 60% of something or 1 in 5, how do I illustrate that if I'm in one of our local churches? Have individuals, like, I love to have individuals count off if I'm doing a 1 in 3, 1 in 5 type of statistic, right? To show in this room, this is what the data looks like. So it's making to say we can take our data and make it real world, make it real life and real applicable to our community so that they see themselves in the 60%, 80%, 70%. And I think that that's what we have to do, is to say we have the lived experience, we have the data. How can we illustrate both simultaneously to be able to, I think, really begin to move the needle when we think about the things that really do rise to the surface of what these individuals are saying would be helpful for me. Again, whether it's just, I think, the early access to diagnosis, the early opportunities we have to prevention, like how we've been talking about health equity for what I feel like is a really, really long time. And then all of a sudden COVID came, and then it was really, really, we're going to talk about health equity and we're really, really going to do something about it, now that we're in the midst of this pandemic, although we've had these same issues a long time. So for me, it's saying, okay, well, how, if in this Alzheimer's space, if we're thinking about caregivers, if we're thinking about the 2/3 of caregivers, are caring are women, if we think about the health of our caregivers right now, they are on the path to having significant increases or risk for developing Alzheimer's and dementia. And so if we can't really look at health equity as something that happens outside of the healthcare institution, right? Health equity is my ability to have a good job. Health equity is, if I'm a caregiver, to hopefully be able to stay in a good job that I have. Health equity has to be about my children's access to good education and good schools, because by them having good education and good schools, there's some, association to say they may lower their risk of developing Alzheimer's and dementia. That is what genuine health equity is. It's all of those dimensions of wellness that we often don't consider when we have conversations about health equity. It's drugs, it's treatment, it's research, it's those things. And yes, that's included, but we've left out about at least 7 other dimensions of our well-being that in this space, especially for caregivers, we cannot afford to not have all those conversations.
Call it life equity in our conversation.
Yes, life equity.
Yeah. What we've been focused on in the Advocacy Exchange through the last more than 3 years of listening to the community is how to help people navigate discrimination. And many individuals say they don't know it's discrimination when it's happening, but it doesn't feel right. And how do I know what to do? And then the other part of it is, how do people use their voice to advocate for themselves and advocate for others? And I know, Ross, that in our conversation, you were talking about how important voice is. And so how do you bring that component into this work that you're doing to really make sure the voice is a part of everything you do and advocate for?
Yeah, I mean, so it kind of goes to this thing we were talking about earlier about sort of making sure that we're talking to enough people. So we've got a program that talks to a whole panel of people across the disease spectrum and racially and ethnically diverse, rigorous research saying what matters to you. This set of 42 items came from this kind of research. It's really rigorous, and it's also intended to inform, insurance companies of what matters to people. It's intended to inform the FDA when they're looking at drugs, what people will value in a medicine. It tended to help people validate their own experience as well. And then we also do snapshots. So when there's an issue in Alzheimer's disease, we just have a cohort of about 10,000 people. We go survey and say, what do you think about this one thing? And so this other cohort, this long-term research about what's important is a multi-year project done by a bunch of academics, and it's good stuff, really important. But sometimes you just want to know, what do people think? Because I don't want to just go with my gut or my experience. I want to always take a snapshot of a broad spectrum. And then through that, we can also identify people who are really, really articulate. And then we have the work we do on Capitol Hill and the work we do with the agencies gives those folks a chance, or our board members gives them a chance to speak and tell their particular story. Our board members all have a personal connection to Alzheimer's disease, and a couple of them are actually living with it currently. So it's important to have that representation and help people find a way to raise their voice in a disease where I think it's fairly common that people feel like nobody really wants to hear from me anymore. That's just wrong.
Russ, can you stay on that just a minute? Part of the shame is with memory issue, not being certain of what you've shared or haven't shared. And how do you encourage folks, in those vulnerable spaces to just trust sharing their voice wherever it is?
Yeah, I mean, it's going to vary from person to person. One of our board members who I know pretty well, as he's progressed through the disease, has felt the need to write out comments. If he's going to make a complicated set of thoughts, he'll write them in advance, read them. People have to adapt to where they are and what makes them comfortable. And we just try to give people ideas that have worked for other folks, and then whatever works for them. But what doesn't work is being quiet. What doesn't work is letting your carer do all of the talking. Your carer can be a great advocate for you, but in the end, if you have the disease, we want, as long as possible, for you to be able to talk and speak your truth.
Pamela, you talk so much about with all the things people have to balance internally and externally around them. How do you try to encourage and respect the importance of individual voice?
I think a little bit to what Russ said is, I think by making sure that we let them know that there is value in their voice, right? That there's power in their voice. We do a lot of work in faith-based spaces. Well, scriptural text, biblical text, tells us to speak to things in our lives, and that there is power in the tongue, that actually the power of life and death lies in the tongue. So by really leaning into that, especially when we think about, again, the churches that we work, to Russ's point, when we're trying to say, are you aware of this? Do you know that this is going on? Well, what do you think about this, right? So it's in those moments that we then can say, okay, you now have a voice. Not if you're a pastor or a bishop, your voice resonates beyond this pulpit, beyond the walls of your church. How do you use and harness that to then also empower others around you? Again, to say, when you are comfortable to share both a good and a bad experience. I think if the only way we're going to address, I think, some of the biases and what it really is like to age as a minority in this country, we have to make sure that those minority communities feel that not only does their voice matters, but that it will be heard, and that you will listen to what I'm saying and then do something with it. I think what we like to challenge folks most about is going into these communities, having them actually share use their voice, give their testimonies, give their stories, give you their why, and give you what they believe solutions will be for their communities, and we do nothing with it. That is where we perpetuate the cycles of mistrust and distrust. And you often see folks saying, well, yeah, we gotta build the trust. No, you have to earn it. It's nothing that you can build. You have to show you are trustworthy in order for me to give my trust to you. And by doing that, then now we're saying, okay, we're creating individuals who now within their families, now within their communities, now within their schools, their churches, their mosques, their synagogues, everything. And now their voices collectively are coming together. And that's where I think the power really lies, to be able to move the needle, because you have more than one person saying this is bothering me. You now have a collective, group who are all saying, no, we are sharing similar and or same experiences. And we've come together to say, here is what we want from you, congressman or congresswoman. This is what we want from you, drug maker. This is what we want from you, health insurer. I want to be able to not have to jump through 10,000 hurdles to get the diagnostics that I need to find out definitively if my mom or my husband or my grandfather has Alzheimer's or dementia. And I think when we can get to that level of that volume, like if I think about it, when we can crank it up, and that's the volume that we've been able to achieve by the collective joining of voices, I think that's where we really will begin to see, I think, some significant changes in this space.
And you know what Pamela was saying about what it is to be living as an older minoritized person in this country. Don't underestimate the older part. Ageism is huge. If you think about, you watch most stand-up comedy, late night comedy, sitcoms, or even certain presidential candidates, and it is absolutely still okay to make fun of old people. And it is absolutely still okay to make fun of or to judge people's cognition and their possible lack of cognition. Still safe ground for an awful lot of people. So when you talk about ageism, it's a huge thing. You double that with minoritized older folks, it's a big doggone deal. And it's that stigma, and people sometimes self-stigmatize with getting older. You get surrounded enough by this ageism thing, and you start to feel like yourself. So those are huge hurdles that I think both organizations have to get over in getting people to be willing to speak their truth.
Whenever I feel nervous to say something, I know it's usually something important that has to be said. Pam, I shared with you in our conversations, one of my mentors, shared with me her experience as a young girl, and her mom telling her, sorry, we can't go in here, we're not allowed. And what that conversation was like to her, and how at her age now, that's still such a raw part of everything she does. Um, how do we make people feel heard and do our parts to not just listen, but act on these experiences?
First, I love that question, because it allows us to begin to shift into what we need in thinking of humanity, right? Because that's really what we are trying to get at. I would much prefer to walk into spaces and not be seen as a Black woman or a Black mom. I'd rather walk into here and be seen as a human being, as a person who bleeds, as a person who cries, as a person who laughs, as a person who screams, shouts, yells, and runs the gambit of life's emotions, right? And that my existence does not take away from anyone else's existence in this world. That my taking up space and time could, and in most cases, I think if we all sit back and look, actually is a benefit to others. It's a benefit to me. It's a benefit to my children. It's a benefit to my communities, to my friends, to my family, to colleagues and networks and situations. And I think until we can start to peel back those layers to say that these are the human elements that we all share. that we will never be able to completely just disconnect ourselves from. And being able to say, okay, well, that's where we are all rooted. So if I'm rooted in the same space and place that you are, right, then that means we collectively can till this soil and make sure that, again, that our roots continue to grow, that we continue to bear good fruit. And that, I think that's, you know, because when you shared that story with me, and I thought, and I think I shared it with you in some of our initial conversations. I remember as a young nurse having an elderly white man who refused to allow me to care for him because I was Black. He called me many names, and he was adamant that he would rather lay in his own feces than to allow me to care for him. And this was after repeated attempts of me letting him know that I'm the only one that's going to be on this floor on this shift because we were so short staffed that particular day. I came back hour on hour on hour saying, hey, are you sure? Is there anything I can do for you? I don't, and did not, and even today, I don't begrudge him for how he treated me. He was someone who was in need of something I could provide to him. And because of, I think, just faultiness in what he was perhaps exposed to growing up or as a young man or as a young individual, he could not see me as just another human being wanting to help him in his time of need. And so I share that sometimes with people like, well, I would have just let him, lay in his mess all day. And I was like, why? His names and what he called me, they were not pleasant. I didn't like them. Obviously, we're not appreciative of them, but I still told him, but I still was in the position to help him. It said more about me being willing to help him as opposed to just closing that door and waiting till my shift was over, report to the next person that he called me X, Y, and Z. I didn't go back into the room. So I don't know how he's doing, after this 8 or 10 hour shift. And I think it's in those moments that when we can then take those and eventually, I think the next nurse who came on was white, and I think eventually he was able to get cleaned and the care and things that he needed. But I think it's in acknowledging that it is more about our response to those types of things and situations than it is of wanting to try and understand why he didn't want me to clean him. It was more about how am I going to respond to it? And if I can respond to it in a way to show him my humanity, I think each time we all get an opportunity to do that, to rise above the wrong, to rise above the negative, to rise above the biases that we know we still continue to see in this space. But if my response can be one that calls and speaks to both me and your humanity, then I think that's how we begin to change, and we can have less and less and less, because now I've hopefully shifted a culture. I've shifted hopefully a mindset of individuals by being able, I think, again, to really realize that, we're all going to leave this place and go somewhere and return to some earthly or spiritual form. And so while I am here in this fleshly body, how do I make sure that I am walking in a way that models what I want my healthcare system, my education, what I want life to look like? How do I model that for me, my children, and those around me? And I think that is what we have to make sure that we never, ever lose sight of. Otherwise, we'll go back to situations to where, like, Sheila was saying, where, hey, I'm not welcome here. I think we want to get away from any space that we would say someone is not welcome here.
All the moments that you get to feel the hero that you are and the remarkable human that you are, I'm so grateful because of the moments that you weren't treated that way. I just want to respect how significant that is. Thank you for sharing it. it helps me, Pam, really understand, and this is something Russ, we talked a lot about, the three of us, the difference between partnerships and relationships. And, Pam, you were talking about what a relationship means to you and being able to do this work. Russ, can you share with us, so much of your work is partnerships and creating coalitions, and you spoke about, partnerships with individuals versus organizations. How do you bring that relationship approach into all of it?
Yeah, so I think that we do as Us Against Alzheimer's a lot of advocacy on the Hill because we try to figure out the big levers that can be pulled, and there's really big levers on Capitol Hill and with the agencies in Washington. Those are huge levers in this country, and pretty quickly you learn that the folks that you're talking to hear a million ideas every day, and like 500,000 of them are good and important, and they can only do so many things. So you can go in there with the pure heart and the best cause, and you can have an incredible spokesperson like Pamela Price, and they've heard it all before. And there's only going to be a few things that they're going to pick that they're going to do. And so bringing groups together, bringing coalitions of organizations who care about similar things, not just the Alzheimer's folks, bring the chronic disease folks, bring the cancer folks, bring a lot of folks. If you can find common ground with groups who have adjacent missions, that's when people start to stand up and say, this thing we're talking about, it's not just special plea for one group of people, a special plea for a lot of people, whether that's in America or whether it's in Europe, wherever it is, this idea of bringing coalitions of groups together. And it may not be the most important issue to somebody else, but they also know that like this principle that we're standing for here is going to be important to the people that I serve as well. So that's one thing. And to Pamela's point about earning trust, you can't do that sort of coalition building, partnership building as a one-off, as a I'm going to do this tactically because this time I need you, and then next week I'm just going to turn my back right on you because you can do that once. You might be able to sell people once, but you've got to be there. And then when it's an issue that they care about, and you think about it, yeah, that principle is important to my folks too, then you got to say yes to them. So it's got to be a two-way street. You've got to earn the trust when you're building a coalition of organizations. That's the organizational piece. The individual piece, we also need to form partnerships, advocacy, relationships with people, because as I said, I do try to root what we do in data. That's important to get data so that you're not just representing a one-off. But in the end, data plus good stories is what's going to move people. And so you want to build the relationships with people who can tell a story. I don't have Alzheimer's disease, at least that I know of, and at least not yet. But if I can bring one of our people in the earliest stages of the disease who is quite articulate, they can say things that is not just their head, from their heart and what they mean, but from their life. And building those partnerships with people. We stole an expression in our world from people with disabilities: nothing about us without us. And we really try to live that. That's why we have people with Alzheimer's on our board. That's why when we do our annual, we have people with lived experience there. It is so important to be able to form those genuine partnerships, not just with groups, but with people living with the disease. And what level that needs to be. If it's just responding to a survey, you've got a voice that way. If you want to talk about it, we can give channels for that too.
You both make me think of a quote that I love so much, the Kierkegaard quote that says, if we want to go fast, go alone. If we want to go far, go together. And, Pam, when you talk about, seeing each of us as humans, the only way to go is together. And so can you share, in what you've shared already about, what relationships really mean, the honesty, the openness, the trust, what does that really mean?
Right. And I think I shared with on our call, like we talk about partnership or like collaboration, right? Those are very transactional. It's saying I'm coming to this partnership and I'm bringing this. I think you're going to bring this. And collectively, we might be able to do one or two great things together. And then now this partnership has run its course. Relationships are saying, no, I'm here whether you have nothing to contribute or you have everything to contribute, because I feel that collectively together, we are both headed in a shared direction or here, or, headed in towards a shared vision, right? That's the difference between the relationship and partnership building. And it entails everything that, Russ said. The communication has to be bi-directional. It has to, oftentimes I hear folks are, devil's always in the details. It costs money to reach people. It costs money to intentionally and effectively engage individuals. High touch will not get you the trust that you seek. High touch is not going to get you the level and depth of the relationship. You really got to find a good mix of both of those things. Like to Russ's point, how do I create multiple channels, multiple opportunities for you just to simply engage, to share, connect, to listen? Sometimes we don't sit and listen to our communities. We already come in with a whole plan of this is what we're going to do. This is what you need. We're telling communities what they need without even asking, is this what you need? Is it what you want? And if it is this how you want it delivered? That's where the individual piece comes into play, right? Those individuals become your trusted sources. They become your gatekeepers to say, I went and I heard and I listened to Russ and they had some really amazing things that they were talking about. And I did this survey. Word of mouth, if to kind of get into the marketing and communication, when you have a program or have something that you're trying to get people involved in, word of mouth, especially in our minority communities, is still your bread and butter to reach people. It is not paid ads. It is not radio, TV. It's not, it is word of mouth. So by touching the right individuals, you get the word of mouth that you want. And hopefully it's a good word. Hopefully you're being talked about really, really well. Hopefully that you saying, hey, this is an organization that, we would invite you to the cookout, right? You won't be invited to the cookout if you do exactly what Russ said and you come in, you get your data. We don't know what you did with it. We never see you or the data again, right? And so I think it's just making sure that if we've already placed a certain value, a return on investment in these communities, that we also allow them to then give us their own value of what we have and what we're offering. What is their return on investment by coming into relationship with us? And so I think again, it's how it's the lens in which we are looking and approaching this relationship building.
That's the day. We get companies asking us, what do people think? And we might do that survey. What do people think? But we'll only do it if we're allowed to publish that and give back to the people we asked the question. But something you said a second ago made me think. You talked about the difference between partnership and relationship, the transactional nature. And I was thinking as you were saying it, that like people, Coca-Cola made some kind of a deal where you go to a Home Depot and there's a Coke that you can get right by the cash register. And that's some kind of trend. In the non-advocacy world, that's not what we're about. We're not about trying to what is and I don't know who pays who for that thing. I don't know how all those things work. We don't think like that in the nonprofit advocacy world. We think what we want is something we're going to want, and have to it's really important to us, but you don't think that this part of it is important. So we're going to get the common ground of what we all think is important. And that's also, the nature of a relationship is it's a give and take thing. It's not you don't just sort of come and lawyers to ink a deal and then walk away. And then as soon as the numbers don't start working, you walk away, which is what that transaction that Pamela's talking about is.
Right.
In the nonprofit world, form a partner. It's a real partnership with a relationship behind it. It's not action.
100%. Don't be the kid at the park that gets upset the first time that things don't go his way and you take your ball and you go home. Like be the kid who stays, like that's where, like, when we're talking with people and partners, like, do not be the individual who wants to take your ball and now I am going home. No, let's keep your ball here, and we're all going to, let's pause, let's talk about it, let's sit and really figure this thing out together. I think, and again, that's if we, and that's a very childlike thing, but we have adults who come into spaces who, are saying they want to do equity work or advocacy work, and to the point to Russ just made, but because everything didn't line up the way that you had thought it was going to line up, you are taking your ball and saying, okay, I'm just going to now go home. And as opposed to saying, no, there's some common ground somewhere. Let's find that, and then we can build from there.
And the word co-creation is sacred, right? Because it has to be a part of the setup before, the activity during, and then what happens as a result. And when I hear you talk about, this co-creation process, it's how we include those voices and those experiences through the whole process.
Don't build without. I can tell people, like, don't invite someone to a table you've already built. If you walked in and there was no table, y'all build the table together, because you don't know whether this table should be square, round, rectangular. Do we see 10? Are we seating 20? So, and again, and we kind of want to come in with our table already built and sit it in the community, and then say, okay, y'all come to, and they're like, this doesn't look right, it doesn't feel right, it doesn't fit, because it's more of us here than maybe what you knew, because you didn't have the data, because you didn't come in here and talk to us, ahead of time. So I think we save time, we save money, we save energy, and I think in the long run, we have greater, or the potential at least for greater impact, when we do this collectively, straight from the beginning, about saying how do we marry the data, how do we marry the individual lived experiences to create a co-branded, picture or landscape, and then use that to say, now this is what we want our infrastructure to look like. Because that's really what we're talking about. We're talking about an infrastructure that supports this kind of life equity, if you will, that addresses Alzheimer's, dementia, chronic disease, cancers, all of these things that our communities are facing. And that requires an infrastructure right now that we have, I think, in bits and pieces, but not in totality. And it's the relationship building that I think can start to smooth and lay the groundwork for that type of infrastructure.
And if I think about the people who are here with us live now, and then everybody who will get to see this going forward, for the caregivers, the advocates, the professionals, what can we invite them to do? Where can they do more of this with you, or what should they check out?
I want to first invite them to breathe. I think, like, even Russ mentioned, he and I work way more than 8 hours in a day. I have children who are on spring break now who are like, we haven't seen you all week because they have spring break and I've been at work or elsewhere. And I think for caregivers, especially those of us who we care for our loved ones in our home, we are the primary individual providing the care. I would say breathe, because we don't pause to take a minute to breathe. We don't pause to take a minute for ourselves. So I would challenge first each and every caregiver, or if you're not a caregiver and you know a caregiver, call that person up and encourage them or ask them, what can I do to support you to get 15 minutes of just you? 15 minutes by yourself of just solitude or quiet or whatever they want to put into that 15 minutes, or 5 minutes if they can't get the 15. But I think that is a huge thing, because our caregivers are under so much stress right now. And I don't think we get encouraged enough to pause and to say, no, I want to pour something back into myself because my cup is empty right now. Most caregivers are pouring from empty cups. We have to pause and allow ourselves to be refilled so that we can continue on this caregiver journey. So that would be first and foremost. I think in terms of getting engaged in advocacy work, definitely this June, the second Sunday in June, the Balm and Gilead will be doing our 6th Memory Sunday. So Memory Sunday is a day that we've designated as just a Sunday where it is all about caregivers. It is all about our individuals and our family members and loved ones living with Alzheimer's and dementia, where we are inviting congregations to make those specific Sundays dementia-friendly Sundays. We're going to have a Down by the Riverside concert because we understand the power of hymns and music in this space and what that does for individuals who have dementia, and even what it does for us as caregivers, right? Music is so healing. And so I don't care which genre of music that you like, but there's something in the lyrics or the melody of a song that can transport us or at least take us to another time. And so I encourage you to definitely connect with the Balm and Gilead so you can watch us and participate in that concert that we'll be having in June. We've got our new Memory Sunday toolkit and our new book of Alzheimer's that we've done some new tweaking and updates that will come out in May. So if you can, go to www.balmandgilead.org, join our mailing list, and that way you'll be kept up to date on all of not just the Alzheimer's work that we're doing, but all of the great, other things that we're doing as well in mental health and in HIV and AIDS and multiple myeloma. Like there's so many things impacting our communities, and we just again want to figure out how do we be a voice, and more importantly, how do we help others find and use their voice to be able to make and create the change that they want to see for themselves, for their families, and for their communities.
That's so powerful, Pam. Music resonates with me so much. When I was going through my diagnosis, Kirk Franklin was my anthem song. This is it. And that got me through so much. So I adore what you'll bring people together for at that event to fill their souls. That's amazing. Russ, what is it for you? What are your words for people on this journey?
Yes, people are in different places and different journeys. So I think that what Pamela started with, put on your oxygen mask before putting on that people around you, something that we all forget. And I suspect all three of us on the call and probably folks who are tuning in right now have forgotten. And it's, you just have to. And so remind yourself that you should do it. And it's okay. It's okay. It's necessary. So that's number one, no matter where you are. Second, I think there's probably going to be some folk on here who aren't sure they or their loved one is on a journey. So I would recommend they go to our brain guide, www.brainguide.org. Brain Guide is a free resource to learn about the disease and also take a quiz to see whether the symptoms that you're experiencing or the person you care about is experiencing are sort of part of aging, because there is some normal aging that happens with people. It's something that's more than Alzheimer's disease. So go to brainguide.org, mybrainguide.org to check that out for anybody not sure. And then I think it's important for people to get educated, and Brain Guide will do that for people. Get educated. It also is a disease. Dementia is a set of symptoms. Alzheimer's is one cause of that set of symptoms. I didn't really know that until it started affecting me personally. Alzheimer's is a disease. Dementia is a set of symptoms. Basic things like that. And because it's a disease, diagnosis of the disease, and then to see with your doctor what can be done. If you get a doctor who won't give you a diagnosis, get another doctor. Just go find something else, because if they give you a diagnosis, they're not helping you. And then get involved, whether it's with Us Against Alzheimer's, Balm, and Gilead. There's lots of organizations out there that take people who want to get involved. And if you're part of an organization who's doing something in the Alzheimer's world, then get in touch with any of us, and we would love to get in a relationship with you.
Well, I love that. On the Advocacy Exchange, we've compiled resources that are personal stories of individuals sharing their experiences, either with discrimination or wanting to use their voice, and then learning about and understanding disparities, and then ways to take action, right? And so, what can we do to use our voice? And so, we encourage everybody to check those out. Both Pam and Russ's information will be in that information. Pam and Russ, I want to thank you so much for your brain and heart power in this session. I wish we had a lot more time to continue this conversation, but for all of us moving forward together as humans, we are incredibly grateful for what you've spent your time with, all of us. And thank you to everybody who's been here with us live or who will watch this later another time. Thank you all so much.